This government meeting is brought to you by Eastworks and our local cable subscribers.
So, do we want to make a motion to start then?
I'll make a motion to start the meeting.
Go ahead.
Oh, I
The meeting of November 15th
make a motion to start the meeting of November 15th.
at, what time is it? 5:02 PM. I second that motion. All in favor, yes. Maggie
Yes, Amy.
and Beth
Do we-
Rist currently absent.
Do we want to do a roll call or after? After you say all your stuff?
Yeah, let's do that.
Okay.
Just in case she pops on. So just a brief statement to start the meeting. We will begin in accordance with Mass General Law. We're required to let you know that the Board of Health is recording this meeting. We will begin with the public comment portion of the meeting. During that time, anyone who has any public comments is limited to 5 minutes. Please note that during this time, the board will actively be listening, but we will not be responding to any comments made, and they will be saved for future discussion. We will not be, if you have any questions, please put those in writing and submit to Jackie or Bree. Jackie, our administrator, and Bree, our director of health. I'm going to just lay some ground rules for the public speak portion of the meeting. There will be no disruptions, booing, heckling, or intimidation of any speakers. Do not speak unless you're recognized by the chair. All speak time is addressed to the board and not the audience. So with that being said, is there anyone here that would like to participate in public speak time? You can raise your hand with the emoji down at the bottom of your screen. Nope. Okay.
All right. Do you want to do the roll call?
Yeah, I guess.
Okay. I can always put her as late. We've done that before. I can put her in. Maggie Hebert,
Here.
Amy Petrowski,
Here.
Beth Rist, absent at this time.
And Jackie, just record what time she does.
Yep.
Yep, okay. So the first item on the agenda is to approve our meeting minutes from June, July, and September. I didn't see anything that caught my attention in my scan. How about you, Amy? Did you get a chance to look at them?
I wasn't at the June meeting, so we can't pass those. And I think for the ones that we were all three here, which I think are the rest, we should wait for Beth, if it's okay with you.
That's true because she was at all three meetings. You're right. Correct. Time is it? So the public hearing portion isn't going to start for another 5 minutes. Just
You want me
looking.
to do my updates? Because I
Yeah,
can get.
that's a good idea. Yep.
So like Jackie was saying, permit renewals have been sent out to everyone. So those should be coming in soon. We are getting an environmental assessment done of Rubber Thread Pond, which is the pond behind City Hall, which has had cyanobacteria in it consistently since, I don't know, June. Like, it has not gone away. So we have Fuss and O'Neill doing a pretty extensive assessment, checking. They're going to do some testing of the actual sediment at the bottom of the pond, and they're also going to be doing some testing of the outfalls, I believe they call them, which is where the water's coming in. There's going to be a fall round of testing, and then I think they're going to resume in the spring. But cyanobacteria has only really been really pertinent in my career in the last couple of years, and this is the only pond where it doesn't dissipate. Last year it stayed all throughout the winter. It froze green. And so I've been working with the mayor about getting that assessed because it's just something we're going to deal with every single year. We are offering Narcan trainings now to businesses and residents and the public. And Bridget and I did one today for River Valley Co-op and their employees.
Great.
And we were also invited to do one at Springfield College to a class of occupational therapy students. So I have a friend that teaches there, and she asked us if we knew anyone. And because we're kind of new to this, we it's kind of random going to Springfield, but we thought it'd be a good opportunity to kind of learn and train ourselves on training. So we're doing that later this month. And then I have been talking with City Councilor Zaret and also with Liz and Bridget. And Amy, you probably are aware of this too, just through your job, but there's some harm reduction initiatives that they're doing now are vending machines that would have public health related materials in them, like COVID tests, Narcan, masks, and just other kind of harm reduction and public health related materials in them. That's going to be pretty far out as of right now. I mean, that's going to be a pretty big undertaking for us to develop a program, and we would most likely utilize opioid funds for that. In the meantime, we have COVID tests, we have masks, we have Narcan and fentanyl testing strips. So we have noticed that the fentanyl testing strips can be a little bit of a sensitive subject for people to just, they don't really want to waltz into a public space and say, hey, can I have these fentanyl testing strips? So we've actually put them in envelopes before and just kind of left them in the hallway with someone, there will be an envelope in the hallway for you. But we want to kind of have a more formal way of doing it. And we were thinking of having maybe like a drop box, either inside or outside, some type of mailbox where people can request certain things and we can assign them like a number. So it doesn't say like, Maggie Hebert or Amy Petrosky on the envelope. We can say, number 5 and put them in the drop box. Again, these are kind of just ideas that we're floating around right now, but that's all stuff that we would utilize the opioid funds with. Amy is, and Salem, Mass has, I think they've rolled out the vending machine, and it can be like your typical vending machine that you see, or there's actually these vending machines, I think they're called SOS. It's a brand, and they're pretty cool. They're all, it's all, I don't know what the word is. The technology, it's basically a touch screen. So it's not going to be your typical vending machine. So it's a touch screen and you choose what you'd want. That's just an idea. If you have the time to Google it, I would just Google SOS vending machines and they're pretty cool. There's a pretty extensive capacity assessment that health departments and Board of Health members should have received it as well. But Brian and I tackled the third and final round as of now, which was pretty extensive. It asked for information. It would ask for 5 housing files and 5 food files and 5 camp files, and we'd have to upload them all to the state. And they're gonna have a contracted company look through our documents to basically assess our capacity as health department, see where we're at, and then it's part of a long-term plan to kind of for shared services and regionalizing and seeing where every health department is at. So we completed that on time, so we were excited about that. We had a drive-through flu clinic on the 15th where we had, I think, about 200 people. We had a booster clinic on October 25th, where we had over 200 people come through. And then we have probably our final clinic before the holidays is November 30th from 4 to 7 at Mountain View School. So I think we have about 200 slots right now for that. We already have more than enough vaccinators available that day. I think we have 7 or 8 vaccinators. So we could possibly even add more appointments. But we, that was in the newspaper today. And we sent out the flyer to the schools and the Housing Authority, Community Center, Chamber of Commerce. So we're hoping to get the word out because Northampton did close down their standing clinic at the Elks. So it has been a little bit more difficult to find appointments. So we're hoping people take advantage of this one before the holiday season.
So no walk-in, appointment only?
Right now, it's appointment only. We can't really figure out if we can have walk-ins until kind of the last minute because, if we only fill 170 slots, then we can have walk-ins, but we don't really advertise it as allowing walk-ins just because we don't want to, have enough. So
Is it just COVID or is it also flu?
it's just COVID. It's difficult for the nurses to track, especially with COVID having all the different age groups now and the different doses. And they don't want to, mess up the doses and the flu and the COVID. So we're just doing COVID right now, but we still offer, homebound vaccinations for flu and COVID. And, if somebody really needs a flu shot and they're not homebound, Bridget, I think, can still
Good.
take care of that.
Great.
So that's what we have going right now.
Okay. Anything else, Amy? How's that? So it's 5:12, so we can probably move on to the public hearing portion. So we need to suspend the current meeting and then open the public hearing. So I'll put forward a motion to suspend the health department meeting at 5:13 p.m.
I second that.
All in favor? Maggie, yes.
Amy, yes.
Okay, and then I'll put forward a motion to open the public hearing for City of Easthampton regulations for body art establishments at 5:13 p.m. And I'm not going to read through all the rules and regulations again. We can just go into, it's about the sinks, right?
Mm-hmm.
Oh, do you have to second the opening, Amy?
Yes.
I second the opening.
All in favor? Maggie, yes.
Amy, yes.
I sent you guys some language that I took. I can share my screen or I can kind of just
Yeah.
summarize it. Do you want me to
saw
share
it.
it?
I don't know. It's up to Amy, but I kind of looked at it.
I read it also.
Okay. So since I've started in Easthampton in 2018, I think every single establishment in town has requested a variance for the sinks. So the language that I sent to you guys earlier, I went through the NEHA model regs. I went through the Mass regs, Northampton, Boston, and Easthampton. And I looked at a couple others as well. Some cities and towns don't address numbers of sinks at all. I would say the majority does say one sink per workstation. Boston says one sink for every 2 workstations. I personally don't really want to put a number on it because if we keep putting numbers on things, then we're going to continuously get variance requests, in my opinion. I know like in the food code, when I review restaurant plans, we kind of just use our own judgment as regulators and inspectors to make sure they have enough sinks based on where they're prepping the food or how big the kitchen is. So I did send 2 kind of proposed drafts, which was just, the sinks shall be provided unobstructed and in sufficient quantities based on the total number of body art stations, which would kind of leave it up to whoever's reviewing the plan. Or I modeled after Boston and said shall be provided unobstructed for every 2 body art stations. I think again, every 2 we could run into issues. So
Right, but I also feel like sufficient quantity is so vague
yes,
that it would become a problem too. I don't know if we could base it on the number of tattoo artists working at one time.
So I think, oh, I'm sorry.
No, go ahead. I was done.
Okay.
Go ahead, Amy.
I think the intent of the number comes from ensuring that people aren't walking around with used sharps to go to areas to either wash the hands or bring it to like a sanitizing area when they're putting in the alcohol. There's a name for it.
Yeah.
You probably know it much better than I do. But now almost everything is disposable, right?
Yeah.
Like the process has evolved to a point where I think the regulations also need to evolve with it. What I like about the two is what I've seen in most of the places that I've inspected is there's like two different areas where the work is happening and there's one joint sink, right? Like they're able to share kind of a sink, which reduces the number. I agree with the trouble of finding putting a number on it and then taking away that ability for you to use your discretion. I also don't want to put you in a bad situation where we don't have a code to support you. So
Yeah.
that's what I'll say for discussion.
Josh had his hand up. Is he on? Oh, Josh, your audio is terrible again. Try again.
How's that?
There you are.
Does that work? I don't know if you guys can hear me.
Just keep talking. We'll see how it goes, but you're kind of choppy.
Or it might be like an internet thing. No, I was just stating about the sharps thing you had mentioned is that there are sharps containers that should be mounted in every booth according to the regulations. So there's no reason anyone would be leaving with sharps. That's all.
Okay. Does anyone else have any public speak comments for the body art regulations for the number of sinks? Well, okay. Well, I don't know how to find the between a number and then sufficient quantity. We could do, number of sinks per staff. I don't know, or it all depends, like how many people are working at the same time. Say it's a shop of, that has 10 stalls. You're going to need more than 1 or 2 sinks, maybe, if there's 10 people working at the same time. I don't know if we can make it like a number of sinks per staff working or something like that. I don't know. What do you think, Amy? Looks like she's gone.
I was reading the proposed language. I think out of all of them, I think the NEHA language gives us what it is we're trying to accomplish. It gives us the intent, which is that people can walk unobstructed from their workstation to a hand washing sink. And I think that's a key piece of this, right? It's like they don't have to touch a door. They don't have to touch a doorknob. They're not pushing things. So I think if we use something like the NEHA regulations, it allows Bree to make that discretionary call, but also having the intent for what it is, what we're doing, which adds a little black and whiteness to it, which is where I always feel more comfortable.
So we could
thing
say, go ahead.
I was gonna say the thing with the NEHA regulations, they don't capitalize their definition, so it's kind of hard to catch it. But I defined procedure area and workstation because the way that NEHA is written, it still requires a sink in every procedure area because it says the body art procedure area must be equipped with hand washing facilities. And a procedure area is defined as a room or any surface of an inanimate object, which I don't like, is designated to be used only to perform body art. So to me, NEHA still requires a sink in every station or procedure area. most of our establishments in town do the one sink for every station, but Black Labyrinth is, they have plans in front of me right now which is why we're here mostly. And they're doing, in addition, and they have a sink for every two, but then there's one like guest area and that doesn't have a sink. And I think that that's fine. I mean, there's a sink for every two, and then there's kind of a station off to the side. And I don't think that that one needs its own sink. So I agree with everything you're saying with, saying it in sufficient quantities leaves it kind of open to me or whoever's reviewing it. But I also hate putting a number on it, that one sink for every.
Well, do we have to refer to any, like, can we just say, shall be provided unobstructed for all employees of the body art station? Do we have to even?
Bree, in the situation that you're talking about with a guest workshop in the back, do they have access to a sink without touching something?
Yeah, so at least all of our establishments, except for another one that's being proposed right now, all of ours have like kind of this open floor plan where you don't have to open. So that actually brings a good point. We do have another place proposed where every station is completely enclosed. It's like, I don't know if you've ever been to Lucky's in Northampton, but they all have individual rooms. So I do think that we should put language in there that says any station that's completely enclosed should have a sink of its own. But Black Labyrinth, for example, they have like kind of this open floor plan. So I think that they have a little bit more, leeway on it. So yes, Amy, your question is they can get to a sink easily without touching it.
Yeah, I think that's, like Amy brought up a good point. It's the key of the unobstructed. So adding that language, if it's isolated, or, there's a door, then they have to have a sink.
So maybe just every body art practitioner shall have unobstructed access to a hand sink, and then any body art station that is completely enclosed shall have a sink within its corridors. Something along those lines.
Yeah.
Yeah, I agree. I think if we use the NEHA definition with a changing the workstation, like what they use for workstation to mean anything with an enclosing door, right? Like we could that could be much more easily worked.
Yeah.
I agree. So I think I just need to take out body art procedure area. So it should just say the establishment as a whole must be equipped with hand washing facilities for its personnel with unobstructed access, no doors, such that body artists can go to and from their workstations without having to touch anything with their hands. I think that's perfect.
Yep.
I think that's a good point. So we should just take out body art procedure area and change that to the establishment shall have.
Yep.
Okay. Does, I guess I don't know if we didn't really have I don't know if anyone wants to comment on that before. But body.
I know I sort of did it backwards. I forgot to do public speak at the beginning. Sorry, Josh.
Are you good with me just changing this language? We don't need to, you don't need to see a draft of it tomorrow or anything.
Oh, are you talking? I thought you were talking. Yeah, I'm fine. Are you fine, Amy?
Yeah, just Bree, do we have to actually read it back to you for the minutes, or is the document you gave us sufficient? If we say I make a motion to approve the NEHA language minus the procedure area.
Yeah, I have all this language and I can give it to Jackie tomorrow so she can copy directly what it says.
I'm
Okay.
just saying for the motion, is that sufficient motion?
I think as long as you have with the approved or with the discussed changes and
Bree recited it. We can support
Right.
that. And yeah. Okay.
Maggie,
You wanna-
you want to make the motion?
Okay. I make the
I guess
motion.
you should also just give anybody another chance to talk.
Oh, yeah. Josh or anyone else that's here, if you have any public comment to what we have put forward. I guess everybody's, is everybody muted except for
They should
us?
be able to unmute themselves.
Okay. All right. So I put forward a motion to change the body art regulations. Can I just say what Bree?
Read it because I have it up, or
Yeah, why don't you just read it, because that'll make it more official.
um,
Or I'll read it if you.
yeah, you go ahead, Amy.
I was gonna just say amend, like, so we're not like changing the body art, we're amending what it currently states for hand washing, right?
Mm-hmm.
Okay, so we're amending the language in the body art regulations for hand washing sinks in body art establishments as outlined by Bree's statement.
Do you want me to read it?
Just for official, yeah.
So it will change it to say the body art establishment shall be equipped with hand washing facilities for its personnel with unobstructed access, for example, no doors, such that the body artists can go to and from their workstations without having to touch anything with their hands. Yeah, and I'll put that into our regulations tomorrow with the way that we define things too, because we don't call them body artists. I think we call them body art practitioners. So it will be a little bit different, but
Okay. So Amy, do you feel comfortable seconding?
I would like to have a point of discussion before I second.
Okay.
We're not gonna change anything about what we have in terms of what's required at the sink. So all of that will stay the same.
yes, so in that document I sent you, the first part of it says hot and cold, running water, soap, paper towel, all that kind of stuff. So I'll write that all up tomorrow.
Okay, then I second the motion.
All in favor, Maggie, yes.
Amy, yes.
Okay, so I make a motion to close the public hearing for City of Easthampton regulations for body art establishments at 5:29 p.m.
I second that.
All in favor, Maggie, yes.
Amy, yes.
And then I make a motion to reopen the Board of Health meeting agenda for November 15th, 2022 at 5:29 p.m.
I second that.
All in favor, Maggie, yes.
Amy, yes.
Okay, so next on the agenda would be Owen Zaret, Counselor Zaret, for the ordinance 623 update. Is Owen here? Is
I
Counselor-
am. And
Oh, there he is.
my camera's oddly blurry, so I apologize. This is kind of strange. That's really weird. Let me just try turning this off and turning it on again. But well, okay, whatever. I'm an apparition apparently. But I really am here in the material plane. Can you all hear me? Okay.
Yep.
Yeah, so there's not much of an update to give you, but I know I was on the agenda and I just wanted to kind of give a brief overview because this item hasn't even been discussed in committee. And I know that there's some due diligence going on and kind of in terms of kind of some of the background work with some of the advocates involved. So couple things. One is it's kind of two parts. One which replicates some language that was created in Salem, which I don't really think would affect the health department at all, but basically creates local level enforcement's a tough word, but local level action for city employees or city contractors who may violate individuals' rights to privacy around their seeking or actually obtaining reproductive health care or gender affirming health care. And none of that stuff has anything to do with the health department. So I don't want to dwell on it too long, but just to say that some of the state language around that doesn't really give any good prescriptions for what to do at the local level. But in terms of what we're calling, so that's safe access, and then when we talk about fair access, which does address some of the known deceptive practices by crisis pregnancy centers. The tact changes with the new language, and I totally understand the concerns and the risks associated with the prior language, which basically created enforcement at the local level, which was kind of uncharted waters, as well as, certainly very rough waters as well. And so instead, much like we did, for instance, in our wage theft ordinance, the new language really relies heavily on the fact that the Attorney General, Mass DPH, and Mass Health have all issued consumer advisories around these entities. And so instead, what it does is kind of creates requirements in the city for mostly education, sharing mass.gov websites that talk about these centers and making sure that they're posted on the website, as well as a mass.gov website that also includes accepted reproductive health centers, and also points people to the fact that the Attorney General has created a complaint process.
I found this on the web.
Siri, I apologize. I know Siri was not recognized to speak at the meeting. Also recognizes that the Attorney General has issued a consumer advisory that creates a complaint process at the state level. And so basically just kind of facilitates that, or makes residents or non-residents aware that it exists. And so that's pretty much it.
So what would be the role of the health department if there's going to be, it gets reported at the state level? What would be, I guess I'm just not clear what the health department role will be, if any.
Well, certainly just posting, making sure that this information is posted on the health department website. So just all the mass.gov advisories that exist, as well as, to alert people to know that there is a complaint process available through the Attorney General, and to, potentially just make those complaint forms physically available through the health department. But the health department, and I've spoken, just in transparency, I have spoken to the health director about some of the language that kind of directs the health department to facilitate filling out these forms. But I think it is reasonable to rethink kind of just making sure that the role of the health department is to act as public health agents, just to let people know about this information and that they can find it, not necessarily to act actively in any way other than to assist people who are looking for information.
So, okay. So the initial ordinance where there were penalties and things like that is no longer going to be at the city level.
Correct. It would all basically be saying, here are the state level advisories. Here's information around this. Again, all official mass.gov pages, as well as just making people aware that there is a complaint process available through the AG's office, and that either how to get the forms, or again, just to make physical forms available through City Hall. That would basically be it. I mean, the current language does state that a complaint could have a copy of the ordinance attached to it, but frankly, I don't know if that's as necessary as just really facilitating kind of public health education around this.
Does Amy or Brian, anyone else have any questions for Councilor Zaret?
No, it all sounds reasonable to me. I think providing information is one of the things that health departments do really well. And This is just another piece of information that we can add to our arsenal.
All right. Well, thank you, Councillor Zaret.
Not a problem. Do you need me to stick around to the plastic stuff or?
I'm not sure if the mayor is coming. I can brief the board on where we're at with that next if you want to stick around, but it's pretty straightforward and so.
Okay, I'll just hang out. Thank you.
Okay, go ahead. So this is the fee schedule in the camp. So what's going on with the plastics? Diane?
So the mayor requested to come tonight to talk about it, but I texted her about 10 minutes ago, so I don't know if she's coming, but
Okay.
there's an ordinance that was set, well, it actually went into effect this January of 2022, but there was a 1-year grace period. So January 1, 2023 was kind of the, what I call when it went into effect. But there was some concerns from food establishments because it required all takeout containers and single-use forks, knives, takeout containers, cups, lids, all of that to be compostable. So there was some concern from food establishments. So, and Owen or Councilor Zaret can correct me if I'm wrong, but from what I understand, City Council at their last meeting voted to kind of put it back on the drawing table and continue talking about it. From speaking with Councilor Zaret, some parts of the ordinance is good to go for January 1. But the compostable part for the disposable food containers is kind of back on the drawing board. So we had been sending out a lot of information to our food establishments and our businesses saying to get ready for January 1, and we're going to include it in our permit renewals, but luckily we were able to take out that 1-page flyer before they went out. So from what I understand is it's kind of on hold for right now. So I'll just keep everybody updated. I think it's kind of, the City Council is going to fast track it to kind of get it, finalized ASAP. But for right now, I'm not ready to enforce it January 1, I guess, is what I've got to say, because it's back on the drawing board. So I'll keep you updated. And I sent another email to our restaurants and our Chamber of Commerce to get out to their businesses that we don't have contact with, to tell them, hold off for now and we'll keep everyone updated. So.
Okay. Thank you.
Mhm.
So next on the agenda is change the definition of the temporary food event in the health department fee schedule and discuss recreational camp for children fee.
Yeah, so right now our fee schedule says temporary food events are $45 per day. I believe a business came to you a few years ago who would do events Friday, Saturday, and Sunday, and then the next Friday, Saturday, and Sunday. And they said it was kind of cost prohibitive to do $45 per day. So you, I believe, voted for that business to allow $45 for a 14-day period in one location.
Mm-hmm.
Which is pretty which actually, and the reason you did that was because the food code says a temporary food event is defined as an event in the same location for 14 days, one single event in the same location for 14 days. So I think the intention of the food code was probably the Big E, because that's 14 days long. So instead of having them pay $45 a day, it's just, whatever the fee is for 14 days. We would be veering a little bit from the definition because it's not a single event. A lot of these people will do like abandoned building, maybe food truck Friday on Friday, but then they'll do abandoned building just randomly that Saturday. However, I think the reason we brought it to you is because Brian and I kind of feel like there's this gray area because that one business does that. And then when a new business comes in and asks, we're kind of like, I guess. So we just want to change the definition in our fee schedule. what Brian and I do typically is $45 for a 14-day period in the same location. If they want to do abandoned building on Friday and Fort Hill Brewery on Saturday, it's 2 different fees. And most people are pretty happy with that, and we think it's pretty reasonable. So that's what I would request, but obviously I'm open to hear what you think.
It sounds reasonable to me. I don't know, Amy.
I agree. I think we're being lenient already with our definition of what we're considering a single
One.
41 instance.
Yeah.
And I think it's your modifications are fine, Bree.
Okay. So I will change that to $45 for one location in a 14-day period. And then while we were at it, I figured we could discuss the recreational camp fee, because our fee is $150, but the amount of time that Brian and I spend is really astronomical for camps. I mean, mostly Brian, actually, he spends most of his summer on camps. And the $150 doesn't really come close to covering his time. And the whole point of Board of Health fees is to cover our time. I can pull it up again if you'd like, but we did check other towns. I did send it to you earlier, so I don't know if you had a chance to look, but so I don't know if you had any thoughts on a fee.
I missed the camp stuff. So can somebody read to me?
Yeah, I can share my screen really quick because it. Okay. Do you see this?
Oh, yeah, there it is. Oh, okay. Yep.
So these are other towns. They kind of vary a lot, but.
And we're currently 150, you said?
Yeah.
How many camps do we have?
It ranges anywhere from like 9 to 12.
Oh, wow. Hadley, 450.
Yeah.
I mean, I fully appreciate the amount of time that goes into a camp inspection for it to be done right. And I think protecting our most vulnerable is one of the big jobs that we have, whether that is in a housing for disenfranchised population, but children can't and shouldn't have to advocate for themselves. And that's what we do when we do camp inspections, is we ensure the safety of the location and the safety of the staff and the safety of the medical people who are working it there. It is something that I take very seriously, and I think I appreciate how well it's done in this community. And the Mass General Law about setting fees is that you can justify the amount of time and hours and manpower that goes into setting that fee. And if we look at the nursing time that goes into camp inspections and Brian's time, there is a lot of manpower or person power that goes into supporting, ensuring that these are done well and right. So I don't see a problem with raising our fees at all.
Yeah, I don't either. 150 seems awfully low, and over the years, it's always been a thorn. So, so to speak. I mean, do you have an amount in mind, or? I mean, right off the bat in my head, I don't even want to say out loud what I thought. It's higher than anything that was on the.
I was thinking 300. The only problem is I don't want the camp. I mean, going from 150 to 300, even though 300 is a very reasonable price, it is doubling our fee. So I would say 200 to 250. I mean, probably 250, but and we don't charge per week, and I don't want to, but these camps run for weeks, and So I mean, other towns I've worked in will charge like per type of camp. So sometimes one camp will have like a soccer week, a volleyball week, and a softball week, and they'll charge per week. We don't. We just charge like for the season. So I think $250 or $300 is reasonable. But I just know when you double a fee, that's, you know, kind of stings a little bit more to the businesses. But I think $300 is reasonable.
Let's do a gradual increase. So we
Yeah.
can vote to do 250 for camp year in calendar year 23. And we'll vote to do move it to 300 for calendar year 24. When we send out the reminder emails and give them their camp licenses for this year, we can let them know that they can anticipate in their planning for 24 for it to be a $300 camp fee.
Okay, so $250 for this year and $300 for the following year.
Do you want a motion?
Yeah, do we need a motion for both of these?
No, it can be one.
Okay.
Maggie, do you want me to do it?
Oh, yeah, go ahead.
Okay, let's see if I can get it right the first time.
Mm.
I make a motion to gradually increase our camp permit fees. For calendar year 2023, the camp fee will be $250. And in calendar year 2024, it will increase to $300.
I second that motion. All in favor? Maggie? Amy, yes.
Did we do temporary food too? Did you make a motion on that?
Do we need a motion on that? We didn't change anything but the definition.
Oh, that's up to you.
I don't.
Okay.
I think it's fine because we didn't increase the fee or change the time frame.
Okay.
Well, we are talking about fees. Bree, I think, is it the December meeting where we look at all our fees annually?
We've never done that officially. I did the fee schedule over when I first started, so probably 2018 to 2019. I probably did I think I did the entire fee schedule because I think there was one fee for everything and it was $75. So we did an entire fee schedule in 2019.
So
I remember looking, oh no, it was just when, for fiscal year, when you put it forward, but do we need to go through all the fees?
I was going to.
Go ahead.
So I think we should look at our fees, but Bree, I think maybe if we do it in conjunction with any information gained for our PHE grouping at the capacity assessment, we might be able to have data and really hard evidence to support that adjustment. I know there's not going to be significant information given at the specific community level, so it might be hard to tease that out. But if we look at the state as a whole, where we can see like statewide information and then region-wide information and then PHE level information, I think we'll get some really good data to support any needed adjustments in our fees in order to achieve the performance standards, which will be rolled out in 2023. And the performance standards are no longer going to be an option. They're going to be a requirement, which has never been the case before. So I think if we look at the capacity assessment, the performance standards, and adjusting our fees at the same time in order to achieve the performance standards with the information gained at the capacity assessment, we'll have good info.
Yeah, and I think it's just good practice to look at those every few years just to make sure, wait a minute, because I don't remember everything we did. I mean, you and Brian probably do, but I think it's just good practice.
Yeah, and speaking of the capacity assessment and meeting all of our requirements, we've had Brian for like a year and a half now, but this is the first year that we've had, this is the first full year I've been able to look at January to December, and we still aren't able to reach all of our restaurant inspections. We're pretty much reach everything else. It's just restaurants naturally fall kind of on the wayside. So I do anticipate probably asking for a part-time, probably just food inspector or someone just to kind of get the routine food inspections in this budget year. So I mean, that's still a couple months away, but we can.
Can I make a suggestion on that? I mean, I think we should definitely do that. The state is, I think, looking at the value in not having inspectors focus on one area so they can fill in gaps. Like if Brian were
That's
to
true.
win the lottery, let's say win the lottery instead of any of the negative things that sometimes come to our brain, and he's gone, we have someone who is trained in all of those things who can step in and support. Or if someone goes out on maternity leave or any of the other things that happen in the course of life. So if we write it up in our budget as a,
I was actually thinking about that this morning. If anyone goes out on maternity leave, what do we do?
Yeah,
or parental leave. We can make it parental leave.
Parental leave.
No, I agree with that 100%. But I think when we hire this person, we would just have to be very clear that majority of your time is going to be food. Because I know that people tend to lean towards what they like. And, food inspections aren't my favorite. So I just wouldn't want this person to be like, oh, Brian, I want to do all the housing. Because the food inspections are consistent year round, where like camps are really heavy in the summer and housing can get heavy in the winter with no heat complaints, stuff like that. But we just need someone that can dedicate like 15 hours a week to just like food. And you're right. And if Brian's on vacation, we can obviously train this person to do other things so they can cover Brian. But I just think that they would need to be consistently doing food inspections and then picking up where we lack. But yeah, definitely. And we can talk more, Amy. I know I've kind of mentioned it to you in regards to the whole PHE thing in general, but I think we should put in for it because I don't know the time frame on that the state will move and stuff like that. So,
Okay. Anything else on? Then the only thing is to vote in Bridget and Liz. So I don't even know, is there a formal process that we have to?
No, you voted. Boards of health have to vote health inspectors and agents, or have to vote because we act essentially on behalf of your authority. But Liz was recently working with a resident who didn't have electricity, and she was able to get the electricity restored before Brian and I would even have time to write up the order, because it is a condemnable thing. And this is someone we have history with, but I couldn't write up an order based off of Liz's observation because she's not an agent of the Board of Health, which is silly because she's an employee of the city and we trust her. And but I reached out to an attorney at the Association of Health Boards, and she said 100% we can vote them in as agents. And we should anyway, because they do act, like Bridget acts on the Board of Health and stuff. So this time, if Liz is like, hey, this person didn't have electricity, no heat, Brian and I can just write up an order. Because legally, we have to within 24 hours, I think, of being notified of certain violations. So otherwise, Brian and I had to make contact with this person, and they don't always want to let us in. And it was this whole thing. So I was like, it would be easier if we could just go off of Liz or Bridget's word. So.
Okay. So do we make a motion to do that?
Yeah.
Yep. So I'll make a motion to formally vote in Elizabeth Plouffe as the City of Easthampton's community social worker.
I second.
All in favor, Maggie, yes.
Amy, yes.
And then,
Did you do Bridget too? Sorry.
I think we have to, I'm going to do them separately.
Oh, okay.
Yeah. And then I make a motion to formally vote in Bridget Diggins as our public health nurse for the City of Easthampton as an agent of the Board of Health.
I second.
What? Oh, no. Maggie, yes.
Well, yeah, I was trying to remember what I thought you said. I thought the first one you might have said director, but then no one else looked up, so I assumed that you didn't.
I don't know what I said. I'm so tired.
Just
I've
me.
been up since 4:30 this morning, so I could have said mayor.
For the power invested in us. I don't think Mayor Lessepelle would like that.
Do you want me to do?
No, it's recorded. I'm sure.
Yeah.
We got it. And so yes, Amy, yes.
Maggie, yes. I don't know if I said that already. Okay. Okay, anything else? I think we made it through another one.
Do we want to set a meeting date? Do you want to
Oh,
skip
yeah.
December, or do you want me to send out a poll?
Tuesdays are good for me, like typically really good. So any Tuesday that works for anybody else. We can set a meeting in December, Bree, and if we don't need it, we can always cancel it. That way we don't have to.
Yeah. Scramble. Yep. So if there's no agenda, we can just cancel it.
Right now, December 20th works best for me, or December 6th. I just have a training at 6:30 that night, so it would have to probably start at 5. The 20th might be a little too close to the holidays, so we could do the 6th, just kind of a quick turnaround.
I can do either of those.
I'm fine on the 20th.
I wonder what happened to Beth.
She got called into a case. She just scrubbed out.
Oh, okay.
Okay, so do we want to do the 20th?
At 5?
Yeah. And if we don't have anything, then we'll cancel it. But you're right, we should at least put it on.
On the books. Okay.
To adjourn?
I second that motion at 5:58 p.m. Maggie, yes.
Amy, yes.
I think I'm going to go to bed. I had the same.
This government meeting is brought to you by Eastworks and our local cable subscribers.